Go ahead, Sally.
Okay, good morning, everyone, and welcome to the May 10th, 2021 meeting of the Health and Hospitals Corporation Audit Committee. Start the meeting the way we always do, with a motion for adoption of the minutes of March 15th. Could you all signify approval by saying yes, please?
Yes.
Yes.
Okay. Hearing no objections, the minutes are now adopted. Okay, we'll turn to the first item on our agenda, which is the 2021 annual audit planning presentation. Sorry. Let's see, Tammy Rudinsky and Mr. Weinman from Grant Thornton will be making the presentation.
Would you like me to share my screen so I can control it?
Tammy, it's been projected. I can. Okay.
Okay. Fine.
Just tell us which page.
Sure, no problem.
Okay.
Perfect. So just hold on, give me 1 second. So I can get my page numbers on my second screen. All coordination. So I'll tell you what's okay. So perfect. So if you look at this slide, first of all, I want to just really thank the entire team at HHC, first and foremost, for keeping our city safe. It's amazing. We were just talking before this meeting that a year ago when we were remote, or we started our remote work environment, I don't think that we thought that the 2021 planning meeting would be virtual, but really thank you to the finance team as well as the healthcare workers, Dr. Katz and the entire team at HHC for really keeping and taking care of our city. As it relates to the finance department, really thank you to John and Jay, James, and the entire team for really helping us, along. I think last year we had a very successful 2020 audit in a remote work environment. Again, when we get to the slide, it talks about our timeline, depending on that timeline and where what the requirements are by the CDC and our firm will, really determine if we'll be remote, if we'll be on site, or some sort of hybrid approach. But we're really confident that we can execute. We just issued many 1231 financial statements of organizations similar to yours, healthcare systems, in a virtual environment like we did last year. So I'm confident that we can execute seamlessly as well. This slide that you see in front of you lists the responsibilities for performing an audit. As you see here, these are the audits, or I would say the deliverables that Grant Thornton will perform during the 2020 audit season. Two of them, the New York City Health and Hospitals financial statement audit, as well as the H&H accountable care organizations. Those are June 30th, 2021 deadlines. And the MetroPlus and the insurance company are 12/31, December 31st deadlines. And we'll also be performing some auxiliary reports, our cost reports for June 30th, 2021, both the ambulatory healthcare reports and the residential healthcare facilities reports. So those come a little bit after the financial statement audit. Okay, if you turn to the next slide. There's responsibilities, both those with governance responsibilities, as well as those related to management. So this slide lists the responsibility of the audit committee, which really first and foremost is setting the positive tone at the top. We've always had really clear, transparent communication with the entire audit committee, the board, informing us if there's anything that we should be aware about as it relates to fraud or other significant matters. So really confident that that tone at the top has been established by New York City Health and Hospitals Audit Committee. And if you flip to the next slide, this is the responsibilities of management. So management's responsible for providing us, as they have done in the past, with the financial statements, the notes, the face of the statements, as well as the footnotes of the statements, designing, implementing internal control. Again, this is not a public company. We don't opine on internal control. But as you've heard in our meetings that we presented during the fall, if there are internal control matters that warrant the attention of the committee, those value-added comments will bring it to the attention of the committee as well. As well as management is responsible for informing us about fraud, significant matters, any changes in the environment that would affect our risk assessment process and the execution of our audit approach. And as well as the end of the audit, just at the beginning of the audit, management signs an engagement letter. At the end of the audit, management provides us with written representations on various matters relating to the audit. Okay, any questions? Feel free to stop us along the way. We can make this more of a dialogue versus a monologue, but if there's anything, really feel free to open up and ask any questions. The next is our audit timeline and scope. The nice thing I'll say is that the timeline is similar to the past, but so is our team. So what you'll see here today, I'll be your audit partner. Lou will be your concurring partner. Dana Wilson, who will be speaking in a couple minutes, leads the insurance piece of the audit, as well as Steve and Ray are our senior managers. So as long as we've been the service providers for New York City Health and Hospitals over the past couple of years, we have full continuity of our team from partner down to our senior associates and many of our staff. So the nice thing is, I think that's really what's helped, is that relationship both with our team as well as John and Jay and his team, that we can execute and really meet this timeline and scope set forth by the committee and management. So right now, what we call is we're in our client continuance, our planning phases. So that's really happens during the springtime of 2021. And then as we move more into the summer months, May and June, we really start our preliminary risk assessment, and Steve's going to take you through some of those audit procedures. And what we do here is we take our plan, we take our understanding of both New York City Health and Hospitals as well as the environment, and we'll talk about any new GASB pronouncements that also will come into play this year. But any risk, the external risk factors, and we'll talk a little bit in a couple minutes about COVID and the impact that could have on the risk assessment and the execution of our audit work. And we prepare what we call our risk assessment. And then from that helps develop our audit procedures, our testing approach, which we start executing during our intern field work in June, and then come back in the fall time, August or September, to do the final field work, the majority of our testing, and then we issue the financial statements and deliverables in the October timeframe. You turn to the next slide. This is some additional key dates as it relates to the MetroPlus health plan, which is more in the early, I would say, 2022, as well as the cost reports that I mentioned earlier, to be clear, which are always done in a lag, because those procedures and the website where you actually have to perform and do that work is not available until the spring following the year end. So that would be April 2022 and following up into the fall time frame. Any questions? Okay, I'm going to turn it over to Steve to take us through some of the significant risk areas of the audit.
I'm sorry,
great.
can you hear me,
Thank you, Tammy. So
I
we're
can
on
hear you.
slide 6.
Sorry, I think someone has a question.
Sorry. I'm sorry, Steve. Just one quick question on the timing. The MetroPlus audit is for December 31st, is that right? I thought I heard you say that. I was looking back to.
Yeah.
And
Yes.
so what gets incorporated into the H&H June 30 financial statement?
So that's a really good question. We're going to spend a couple minutes. I don't know, Dana, if you want to address that now in terms of your procedures. There are certain procedures that we have to do for this June 30th year-end dates in order to opine on the June 30th year-end financial statements. Dana was going to talk about that in a couple of minutes, but if you would like, we can just
Okay,
flip right
I'm
to
sorry.
that.
No, that's okay.
No, that's fine.
We can
Okay, fine.
keep going.
Okay, so we'll actually in about 2 or 3 minutes, we're going to be talking about that.
Okay,
Okay,
thank
you can
you.
turn to the next slide. Okay,
wanna-
perfect.
Set up a time of about 15 minutes or so for the presentation, because we have some other
Yep.
items. Okay, thank you.
Okay, we'll be very high level. Okay.
Okay.
Steve.
Okay, great. Yeah, so I'm going to take us through the next couple of slides discussing our significant risks and our areas of focus throughout the audit. And the key theme here is that we're focusing, a lot of our focus is on the high risk audit areas. Those are the areas that include a lot of management's judgments, estimates, and a lot of areas where there's also some technical expertise required to evaluate the balances that are ultimately being reported within the financial statements. The first two items to cover here, the patient accounts receivable, patient revenues, as well as the estimated settlements from third-party payers and the related net revenue with that. So with these two areas, there's a high level of estimation that goes on within these areas, assessing collectability of receivables and also assessing amounts that might potentially have to be paid back to some of the payers, government payers, Medicare, Medicaid, et cetera, through throughout the cost report process, as well as other matters that might arise where there's settlements that are paid to payers. And what we typically do, and have had some really great success, is follow along with management. Management performs the estimate, and we test management's estimate, reviewing all the underlying data that goes into the estimates, performing completeness and accuracy procedures over those, and then assessing the outcomes of those estimates, really looking at historical data to see how has management performed when you look back at the estimates. In other words, if you reported a certain amount for receivables, were those receivables ultimately collected? And we take a look at that, and we look at it really accumulating data over time to assess the accuracy and the adequacy of the receivables in the past, and then have those same procedures or those same underlying estimates, have they been applied to the current period. So, moving on to the next slide, slide 7. A couple of other areas of key focus: the net pension liability. This is another area where there's a high level of estimation that goes into the process. And what we do at Grant Thornton is we bring in our specialists to review the pension liability, the underlying assumptions. Those are the discount rates and the various other assumptions that go into the calculation of the liability, and ultimately, opine back on whether or not we agree with what management has ultimately recorded within the financial statements. In addition, we performed some testing of the underlying data. This is participant data testing that gets performed to ensure that the participant data that's going into the calculation performed by the actuaries is complete and accurate. Around expenditures, we test samples of expenditures. We trace those back to supporting documentation. And really what we're looking for is, not only were the expenditures accurate, but are they accurately reported? Are they categorized into the appropriate, functional expense categories as reported within the financial statements? So that's really there's two things that we ultimately perform within the expenditure testing. And then I just want to touch upon here accounts payable, accrued liabilities, especially including malpractice reserves and any contingencies. These are other areas where there's some level of estimation that goes into the process. It's looking forward or looking back at some of the expenses that have been incurred but maybe not yet invoiced, and ensuring that those are accurately and properly captured and reported within the financial statements. As it relates to any malpractice reserves and any other contingencies, ensuring that the current liabilities that are reported within the financial statements are substantial and enough to cover any of those risks that are out there. We can stop here, take a few minutes, and just transfer over to Dana Wilson, who can speak a little bit about the significant risks related to MetroPlus and the insurance company.
Great, and good morning. As Stephen said, this is Dana Wilson, and I'm the head partner on the MetroPlus audit. The MetroPlus scope of audit really covers an 18-month period. It covers the period fiscal year July 1, 2020 through June 30, 2021. With that respect, we have already audited the 6-month period from July 1st, 2020 through December 31st, 2020, when we did the calendar year audit, December 31, 2020. We then break the audit up into 3 6-month periods, and we'll audit the next period from January 1st till June 30th in connection with the bigger audit. And then we'll come back and audit the period from July 1st, 2021 to December 31st, 2021 when we do that audit. So that's the most effective way to do that, because we are doing 2 separate audits, and we break those up into 6 months to be more effective and more efficient working with your team. We do focus, as you would imagine, a lot of our effort on the investments in cash that are held at MetroPlus. That's the biggest assets that are on the books. And then we focus a lot of our efforts, again, on premium collection, and also have a heavy focus on the incurred but not reported loss reserves, because obviously those are the volume on the expense side. With that being said, I'll turn it back over to Steve and Tammy. And if anybody has any questions about MetroPlus, feel free to let me know.
Yeah, did that answer your question that you had earlier in terms of the procedures? Okay, great. Okay, thank you. So I know due to time, I'm not going to focus on the next slides. You could feel free, hopefully you read it in advance, but it just addresses some of the other areas that we focus on, and we'll come back to you at the end of the audit with our results and explain to you a little bit more detail the testing surrounding that. What I will just turn your attention to is slides 11 and 12, and then we'll talk about some GASB pronouncements. 11 is the technology support as part of the process. As we do every year, we have a team that focuses on healthcare, IT information technology risks. And as part of the process, they don't look at every system within HHC. That's probably impossible, but really those systems that are financially dependent. So those systems that we rely on as part of the financial statement process. And at the end of the audit, they'll come back to you with any control findings they may have or any value-added comments that they see as part of the process. So that's what this slide talks about. And the next slide I think is important, slide 12, if you flip it to that. These are areas that we both focused on as part of our audit process last year, but as going through and looking back at a year in the pandemic environment, these are some accounting considerations that we will focus on as part of our audit process. So whether any asset impairments have incurred, insurance recoveries, funding. I know you've received, various relief program funding. So we'll look at compliance with that. We did it last year as well. Any reserve for uncollectibles, and really look and focus on these risks that are unique to the environment that we're operating in, going concern evaluation. So we'll work with Jay and John and his team to ensure that we don't have any issues with that and really focus on these areas of higher risk as they relate to the COVID-19 pandemic. So these are a little bit new this year. Some of them were incorporated into our testing last year. So I'll pause. Any questions before I think Lou will just talk through a couple of the new GASB pronouncements, technical updates? Okay, Lou, I think if you just push it down a couple of slides, it says technical updates GASB, slide 15, 14, 15. Okay, one more slide. Perfect.
Sure, we can stop there. Thanks, Tammy. Good morning, everyone. Lou Feuerstein. I assist Tammy on this engagement. The GASB is the organization that sets our accounting rules by issuing pronouncements. And it would be an understatement to say that they have been very, very active. They have recently issued 10 GASBs that potentially affect the organization, and they have 10 projects in process that could potentially even impact the presentation of the financial statements. The good news is, related to COVID, GASB issued, I believe, number 95, that basically pushed back between 12 and 18 months many of those 10 pronouncements that were recently issued. So just in a matter of time here, we won't go through them all. Two I'll mention we spoke about last year. One is leases, where we'll be putting those operating leases on the balance sheet as a right-to-use asset and a lease liability. That was actually delayed 18 months and will be effective for you folks in fiscal year 2022. There's another FASB on 89. We talked about that last year, accounting for interest costs. As opposed to being able to capitalize interest during the construction period. Under this GASB, you will be required to expense it. It's that direct variance to how the FASB business world accounts for it, but it's GASB presentation. And again, that won't impact you until 2022. And the last one I'll mention is you may be aware that the LIBOR, the international interest rate set by LIBOR, is going away. So there's another pronouncement that helps you transition out of LIBOR when that rate stops being published in the next year or so into a new rate. So a lot happening. I would say as of now, it doesn't look like anything has to be adopted for this fiscal year end 2021. Although I'll caveat it by saying sometimes the city early adopts, and we try to match the city's accounting with your accounting. So unless they tell us, there will be no new adoptions this year. And maybe I'll just stop just in a matter of time to make sure that you have some opportunity to ask any questions if there are any.
Frida, did you have some other questions? Frida?
I'm sorry, this is Jay
Okay.
Wyman, Corporate Controller. We are adopting GASB 87 this year. The city is instituting that early, and we are implementing that.
Yeah, so that'll take the leases out of footnote disclosure and put them on the balance sheet.
And this is Nicole Fleming, also with the Comptroller's Office. We're also early adopting 89 this year.
Okay.
87, any estimate of the time and the financial impact, or is it too early to tell at this point?
I guess, Jay, do you have a sense? I think, Jay, you're on mute.
I'm sorry. We are going through that currently. We don't have a number right now because it's a pretty extensive GASB reporting. We will have it for the audit, and we'll be able to update the committee on that once we get that calculated.
Okay, thank you.
So, can you hear me, Sally?
Yes.
Yeah. Okay, thank you. On the GASB, I think you said that 89 will also, would that have a big impact, Jay? Or, sorry, I can't hear you.
I keep doing that. It's somewhere between 15 and 20 million. It's not going to be significant for us on the bottom line, but this basically, instead of including the cost in the asset itself and we depreciate it, it will be expensed. But it's relatively small for our financial statements, and won't have a material impact.
Okay. Okay, thanks. Sally, I have a few more questions, if that's okay. Just on the audit, how is T2 treated? Is that included in all of our statements, or broken out sort of separately, or just incorporated, consolidated? Sorry, Jay, you're muted again.
I don't even know how that did it. It will most likely be a separate note on the financial statement, but it will be incorporated in the rest of the financial statement presentation. Both the revenues and the expense, and as you know, it's pretty much a pass-through. It's a sub-recipient agreement, but it has to be reported and transferred through the financials.
Okay.
And
yeah.
Couple of minutes.
All right, Sally, I can't hear you.
Oh, that's strange.
Better now.
Oh, yeah.
Yeah.
Just we can wind up in a couple of minutes because we still have 4 agenda items.
Okay, sorry.
Okay.
Let me see if I can just on the COVID. I guess that's okay. The COVID questions I had, I can wait. But other than just general, Tammy, on the risk assessment, other than the COVID risks that you highlighted, are there any other sort of new risks this year, or risks that may have dropped off from prior years, or is it pretty consistent?
So it should be pretty.
Been looking at.
Sorry.
Mm-hmm. No, go ahead.
I was going to say it should be pretty consistent, but we're still in that risk assessment phase. So what we'll do is we'll sit down with Jay and the team and see if there's any changes, any new something new that's occurring, a new event, obviously besides COVID, like you said, any new large grant agreements. We had a lot of focus on that last year and the year before. So we'll have to assess that. If there's something, that's of heightened risk that we didn't look at in the past, for whatever reason, we'll come back to the committee if it's significant enough and let you know. Any material transactions. Yeah.
I'm going to stop the presentation at the moment. Thank everyone. Feel free to contact Tammy directly with questions if you have.
Okay.
Certainly. Anytime, and we'll exit now, as we always have. Thank you. Everyone have a great day. Stay safe.
Thank you.
Okay. Next agenda item is going to be Chris on external audits.
Okay, thank you, Sally. Good morning, everyone. I'll go through this real quick. So we're starting on page 3 of my briefing. And this is an audit conducted by the New York City Controller's Office of the Oversight of the Auxiliaries. This audit is coming to an end. The preliminary draft report was issued on April 19th, and an exit conference was held on May 4th. And subsequent to that meeting, a final draft report will be issued, hopefully within 2 weeks, at which time a formal response to the auditor's findings and recommendations are required within 10 business days. I will discuss the findings in more detail at the next meeting. Moving on to page 4, this is also an audit conducted by the New York City Controller's Office. This is of the controls over the nursing homes. And since the last meeting, the Controller's Office has continued to meet with the chief executive officers of the nursing homes and the central stores managers who oversee the medical surgical inventory on a day-to-day basis. Most recently, they have requested view-only access to the perpetual inventory system to better evaluate the processes related to medical surgical inventory, including PPE. And this request has been referred to the legal department of New York City Health and Hospitals for resolution. Moving on to page 5, internal audits conducted a review of the controls over laptops issued to individuals for the purpose of conducting health and hospitals business. Our audit test included comparing the Central Office Enterprise Information Technology Services Department, or EITS, list of employees issued laptops to the list maintained by each facility. We also tested to ensure the names of the individuals on the list were those of current employees. The 4 facilities we conducted our test work were Elmhurst, Kings County, Bellevue, and Jacoby, as those were the sites other than Central Office with the highest number of laptops. Our review of the list from the 4 facilities revealed that less than 4% of the names listed were of employees no longer working for health and hospitals. Hence, our conclusions were that for the most part, adequate controls were in effect. When conducting the same test of 248 of the 1,310 names on the list of test and trace personnel, we found the error rate of 25%. We recommended that research be done to determine the disposition of the laptops assigned to those terminated employees. EITS responded that they would coordinate with human resources to ensure that they were notified timely of terminated employees, and that an additional comparison of the EITS and facility lists would be done more immediately. Internal audits also compared the EITS lists with the list of the 4 facilities selected and determined that a total difference of 292 laptops existed. We also noted that 669 laptops on the EITS list were not on the facility list, and 362 laptops on the facilities list were not on the EITS list. In addition, when comparing the serial numbers of the devices on both lists, there were 76 instances in which the assigned employee on the facility list different from the most frequent logged-in employee indicated on the Central Office EITS list. EITS responded that improvements in classifying the different laptops would be implemented and rolled out to all facilities. Lastly, we reviewed in more detail the EITS list, and we noted that it is prepared in a different format from the ones kept by the facilities. The facility lists show the name of the employees to which the laptop is assigned. The EITS list showed the user with the most amount of times logged onto the device and the last logged on user. When comparing this information, we noted 96 instances in which a device assigned to an employee from one facility was last logged on by an individual from a different facility. In 15 instances, the assigned user, last logged on user, and most frequent user were all from different sites. There were also many instances in which an employee was the most frequent user and last on user for 2 or more devices. 9 EITS employees utilized 5 or more devices. During the audit, we were informed that employees should not be assigned more than 1 laptop, except when EITS staff is troubleshooting devices. EITS responded that they are in the process of implementing and enforcing a new one device policy, with each employee utilizing a single primary device. Exceptions will be documented with justifications as to why the employee requires to utilize more than 1 laptop. Any questions before I go on, or should I just finish?
What I'm going to do is go through all the items on the agenda, and then we'll take questions.
Okay. Moving on to the pages 7 and 8. This is regarding the auxiliary audits that are done by an outside CPA firm. As you can see from the table on page 8, final reports for calendar year 2020 have been completed and reviewed by the Office of Internal Audits for 9 of the 22 auxiliaries. 8 reports were compilations as revenues were below $250,000. 1 was a review as revenues were between $250,000 and $750,000. For calendar year 2018/2019, 1 audit report was issued, and that report was for the children of Bellevue Auxiliary. 4 reports remain outstanding for those years due to the lack of appropriate personnel responsible for maintaining the financial records within those auxiliaries. There was a management letter comment regarding the children of Bellevue. It was regarding the incorrect reporting of net assets. It was just a reclassification. It did not impact the bottom line. And as required, the New York State Charities Bureau requires that a review, compilation, or report must accompany their tax return, their CHAR 500. And that concludes my presentation. Any questions?
We're going to move on to the compliance update with Catherine Totso.
Thank you, Sally. Good morning, everyone. I will also try to be brief here. Starting on page 2 of my report, as we always do, the Office of Corporate Compliance conducts monthly exclusion screenings to make sure that there's no one on our workforce or vendors or anyone doing services for health and hospitals is on an excluded list. We learned that one physician employed by PAGNY was on the System for Award Management exclusion list. This individual provided training staff for staff at Harlem. He was removed from the training team upon notification of his exclusion. We will be determining whether or not there is a overpayment there. Moving on to page 3, the privacy incidents and related reports. There were 31 incidents that we found in the period March 1 to April 23rd. 18 were found to be violations of our policies and procedures. 6 were not violations, and 7 are still under investigation. Of the 18 that were confirmed as violations, 1 was determined to be a breach. In this case, the physician disclosed the patient's HIV status in front of individuals who were not authorized to be privy to that particular information. That physician was counseled and enrolled in HIPAA training. Moving on to paragraph 11 for the reports from the Office for Civil Rights. We received 1 phone call and 1 letter from the OCR. On page 4, details the March 23rd, 2021 phone call from the OCR regarding a complaint that was made with the OCR that alleged that multiple people had accessed the complainant's medical record. He also claimed that he did receive a letter from the Office of Corporate Compliance that we had conducted a risk assessment and determined that the breach could not be substantiated, and we sent a letter to him after conducting that risk assessment. The OCR stated that it was attempting to close out the matter with the technical assistance. And on March 29, we received a letter from the OCR formally closing out the case. On April 13th, we received a letter from the OCR regarding an allegation that an employee at Lincoln was on a phone call with someone while the patient was providing her health information at registration. They determined to resolve this matter informally through providing technical assistance and enclosed material, explain the privacy rule, and reasonable safeguards to distribute and share with workforce members, and they closed the case without further action. And even though they did close the case, compliance conducted an investigation and concluded there was not enough evidence to determine that the PHI was impermissibly disclosed. Nonetheless, the employee was required to take HIPAA remedial training, and a new policy was instituted that prohibited employees from using their mobile phones while on duty. In the compliance reports, we had upgraded our incident reporting database platform on March 22nd to one that's much more customizable and allows us to also utilize the same platform to report our HIPAA violations. And as a result, the move to the new platform will save us $47,740 this fiscal year and $53,218 annually thereafter. So as a result, we have on page 5, the reports are in 2 parts. In total, there were 67 reports that were entered into the 2 tracking system. Prior to the upgrade for the period March 1 to March 21, there were 29 reports entered in. None were priority A, 10 were B, and 19 were C. After the upgrade, there were 38 reports that entered into the new tracking system, and that tracking system replaced the A, B, and C priority designations with colored flags, which are red, yellow, or green, representing the severity of the reports. There was 1 red report, 11 yellows, and 26 green reports. The red report was an anonymous complaint from a patient who claimed abuse by staff. Unfortunately, the reporter was not providing any further information, but we are referring, when we get information, to appropriate department. In addition, the new tracking, the new database tracks reports by intake and issue type as opposed to the primary allegation and primary allegation type. And then moving on to page 12. The Office of Corporate Compliance will be updating the principles of professional conduct. This is due to a change in our gift policy as they relate to gifts from patients and family members. Therefore, the POPC needs to be revised to be in line with that change in policy, and we expect to have a draft by the next audit committee meeting. Moving on to the HHC ACO Inc. update. On April 30th, representatives from the HHC ACO met with myself, Chief Corporate Compliance Officer, to evaluate the risks and prepare a risk assessment. We reviewed several topics related to issues that might have a potential impact on the HHC ACO, and that included participation in the enhanced track, participants' expectations, changes in the federal administration, the future of ACOs, meeting quality measures, readmission rates, and the care team funds. None of these issues, however, were determined to create a moderate or high risk for the HHC ACO in the coming year. Finally, on page 13, the coal fire, who is conducting our annual HIPAA risk analysis, will be in May conducting interviews with personnel at the acute care facilities and doing walkthroughs of those facilities and some of the diagnostic and treatment centers. And that concludes my report.
Thank you so much, Catherine. And now, as many of you know, H&H was a recipient of substantial donations during COVID-1, and there's been a project undertaken really nail down the status of each of these gifts and the uses. So Deborah Brown is going to present a status report. Deborah?
Thank you, Sally. Good morning, everyone. And I will say this is probably part one of at least part two, potentially part three of this conversation as we continue to dig into this work. I will also say that I am thrilled to be here today. I am only the current baton holder. There are many more who came before me who worked very hard and should be acknowledged as we talk through these issues. So very briefly, our donations began in 2020, really as we, obtained prominence in the press. We did not solicit these contributions. People were incredibly generous. So donations poured in from families, from individuals, from corporations, just an overwhelming and humbling amount of spontaneous goodwill. The staff at the time, particularly James Linhart and Ling Dang, worked to develop internal systems to process and record these gifts, knowing, of course, that compliance at the other end would be significant. Just this first page just shows you kind of a little bit of the timeline. We sort of set up more official measures in March and in April. In April, we convened an internal philanthropy committee. That's myself, John Alberg, the CFO, Yvette Villanueva from HR, Andy Cohen, our general counsel, Dr. Eric Way, chief quality officer, who really, it must be said, was, the lead for this work at this time and deserves an enormous amount of credit, and Frida Wang, our board member, and that committee continues to meet regularly to this point. And, I'll sort of skip over this in the interest of time, but suffice to say that this work continues to evolve over time. If you go to the second slide, you will see as of the end of April, our totals, quite impressive. As the chairwoman said, total of about $35 million, a little bit more cash than in kind. And you'll see in the box on the side, the donations came from a variety of sources. Some were from this network called Network for Good, which is kind of the easiest way to make a donation. Those tend to be the smaller dollar gifts, extremely appreciated. Some came into James in the corporate controller's office. Those tended to be, a little bit more meaningful numeric gifts. They came from individuals and corporate donors, from foundations. Some companies had matching funds, gift programs, including Goldman Sachs, for which we certainly thank Frida. And then interestingly, some folks sent up these GoFundMe individual accounts. Again, just an incredible way for New Yorkers and people outside of New York to show their generosity and appreciation for our system. So the third slide, quick overview of what the recording process looks like. Monetary donations came in and they were recorded by the cash receipts unit, that is James Linhart and his team within the corporate controller's office. All of those donated dollars are deposited to the H&H collection account. I am told that is the 278 account, and entered in the general ledger. Reports are then made to the reports, I should say, are reviewed internally, certainly by the team members with responsibilities for this, as well as being reported out to the philanthropy committee, roughly 2-week, 3-week basis, depending on when we are meeting. And throughout this, donor information is retained, including restrictions. Some folks asked for their donations to remain confidential. Some folks directed their donations to particular facilities. And so all of that is, of course, information we want to keep for two reasons. One is compliance, which is critical. And then the second is to ensure that we can create good relationships and, properly steward these donated dollars. And the next slide, just wanted to show you an example of the accounting, sort of the recording system that is done. It is, for lack of a better word, a monster set of Excel spreadsheets. We've grayed out anything that would be personally identifying, so you don't see the donor, you don't see the email, you don't see anything that's going to take you to a particular donor, but it shows, how it's recorded, the type of donation, the account, any notes on it, etc. And that's just, I just wanted you to see kind of the work that is going on. And then to the last slide, what's going on now is there is literally a line-by-line review of that spreadsheet of all the donations. James and Ling have been working hard on that. We actually have some outside consultants who have come in to support them, less so on the proper audits because they are not auditors. I want to be really clear about that. They are philanthropy consultants and know how to kind of keep these things locked up appropriately. We're confirming that donations have been used or will be used in some cases for the intended purposes. As I said, memorializing donor information and their restrictions and their wishes properly. Why we will likely be coming back here is because now we're preparing for an internal audit with Chris and his team. James has drafted a process memo that I know is under review right now. And we continue to develop the infrastructure to ensure that as we continue to solicit and or receive donations, we have the proper train tracks and the proper controls in place. So that was a quick overview. I'm happy to answer any questions.
Deb, just your report shows how time sensitive and labor intensive this process has been. So on behalf of the committee, please thank everyone that's being involved in the process. And what I'll do now is I'll open up for questions. Felicia has up to 10 more minutes to have questions answered. Oh, look at that. Not going to 10 minutes. Okay. Well, there being no.
No,
questions-
Sally, excuse me. Fineski has a question.
Oh, hi,
Hi, how are you? Actually, I don't have a question. I just want to have a praise. I just want to praise again Deb, Frida, and everybody has been involved on this. We definitely saw how New Yorkers really supported our system, and having individuals like you really kind of leading the pack and helping us. And I like that you are now kind of institutionalizing this and looking at the stewardship opportunities. I just look forward to learning more about all you are doing. And again, thank you so much for leading this effort during very trying times. Thank you so much.
thank you.
That is kind of you to say. That is kind of you to say, and we're happy to continue reporting back. I would be being untrue if I said that I was leading it individually. There are, many, many people involved, but thank you.
Okay, if there are no other questions, then I move to close the meeting. All those in favor say yes.
Yes.
Okay.
Yes.
There being no objections, the meeting is closed.
Thank you. See you in the next meeting.
All righty.